What is vaginismus? How is it treated? And why is sex sometimes painful? Hi, I am Simone Vella, a consultant gynaecologist at Ross Hall Hospital, part of Circle Health Group, the largest private healthcare provider in the UK. If you are in search of more information about vaginismus and vulvodynia, you've landed in the right place. As a consultant gynaecologist, I specialize in conditions that affect your vulva, including vaginismus and vulvodynia. If you are facing vulval and vaginal issues, it can be difficult to speak up about your symptoms. Not just with healthcare professionals like me, but also with your close friends and partners. This can make living with symptoms isolating and unsettling. If you are experiencing vulval and vaginal problems, you are not alone. Unfortunately, many women today are living with vulval pain and vulvodynia, as well as vaginismus. These conditions can be difficult to live with, but together we can try to make vulvodynia and vaginismus more manageable. It is important to remember that many people with these conditions live happy, fulfilled lives and follow personalized treatment plans that work for them. In this video, I'll be answering your most commonly asked questions about vaginismus and vulvodynia. So, without further ado, let's begin. What is vaginismus? Vaginismus happens when the muscles around the opening of your vagina spasm, as something, such as a tampon or a menstrual cup, enters your vagina. It can make having sex painful, or sometimes even impossible. You have no control over the muscle spasm, it is entirely involuntary. Often because vaginal penetration has been painful before, or because you are afraid and apprehensive that it is going to be painful again, the muscles around the vagina become more tense, making the pain worse. This results in a burning pain during and sometimes after sex. This can last for short or long periods of time. It's different for every woman. There are two types of vaginismus. These are called primary and secondary. In primary vaginismus, vaginal penetration has always been painful. When vaginal penetration has been previously painless and becomes painful suddenly, this is called secondary vaginismus. You will know yourself whether you have primary or secondary vaginismus, whether your pain has always been there or whether it's something new. What causes vaginismus? Sometimes there is a physical condition affecting your vulva or vagina, such as infection, or an inflammatory condition, such as lichen sclerosus, which leads to spasms in the muscles around the opening to your vagina. Other times, there is a history of previous abuse or injury during childbirth, which can lead to these symptoms occurring soon after or later on in life. Often, there just isn't a clear cause for vaginismus. What is vulvodynia? On the other hand, vulvodynia is described as a burning pain on the vulva, which can be generalized or localized, meaning it can be experienced either across your entire vulva or a specific area of it, such as the clitoris or the area around the opening to the vagina. There is no obvious cause for the pain. The pain is often provoked by touch, for example when having a smear test or when inserting a tampon. The pain can settle as soon as the stimulus is removed, or alternatively last for days afterwards, only to happen again when provoked. With vulvodynia, there is often nothing to see on the skin, or at most a slight redness around the entrance to your vagina. Vulvodynia and vaginismus often occur at the same time as one another, and symptoms of these conditions can overlap. Vaginismus and vulvodynia can lead to feelings of anxiety, shame, embarrassment, or frustration, and this can negatively impact your overall well-being and everyday life. It can also affect your relationships and your ability to have a fulfilling and satisfying sex life. Knowing how common these conditions are for women can help alleviate some of these feelings of shame and embarrassment about your symptoms. You can always reach out to a healthcare professional for help, and you should never feel embarrassed to do so. Your doctor will have seen women in your situation many times before. How is vaginismus and vulvodynia diagnosed? There just isn't a diagnostic test for either condition. Vaginismus and/or vulvodynia are typically diagnosed after an in-depth discussion about your symptoms with a gynaecologist who specializes in this area. Your doctor will want to conduct a physical examination of your pelvic as well as your vulvovaginal area to look for any underlying physical conditions or infections that could be contributing to your symptoms. You should always feel in control during examination. Your doctor will be very gentle. Sometimes you may not feel able to have a vaginal examination during your first consultation. However, just examining the vulval skin and using a cotton swab to delineate the area of pain is very useful. Swab tests can also be done to check for infections such as thrush. What are the treatment options for vaginismus and vulvodynia? It is not always possible to make the pain go away, but you can work with your multidisciplinary team to make your symptoms more manageable so that they are no longer controlling your life. For vaginismus, treatment options usually involve a combination of pelvic floor physiotherapy to help stretch and relax the pelvic floor muscles, as well as special breathing techniques. Vaginal dilators are cylindrical devices that come in many different sizes. Starting with the smallest size and gradually progressing to larger sizes can help you to stretch the vaginal walls while relaxing the vaginal muscles around them. Understanding the psychological factors contributing to vaginismus is an important part of your healing journey. Counseling and talking therapy, either individually or with your partner, can help address any emotional or psychological issues that may be contributing to vaginismus. With vulvodynia, or vulval pain, your doctor might recommend using topical vulval numbing ointments or gels to reduce pain. Oral medications, which work on the nerves which are responsible for pain sensation, may be prescribed. Pelvic floor physiotherapy is often helpful with vulvodynia too, and this often requires sustained treatment over a long period of time. I hope this video provides you with the information you need to get help for your symptoms. It is important to remember that although living with vaginismus and vulvodynia can be difficult, there are various treatment options available that can make these conditions more manageable. If you have any other questions, please don't hesitate to leave them in the comment section below. Thank you.